So basically, yesterday we start body points for external applications. Okay, so we know that we have 45 points. Okay, so in that 45 points, we are going to apply electricities initially, second, along with external remedies which are present in electrohomeopathy, and third is according to the condition of the disease. Okay, so we studied about point number one. Yesterday we saw that supraorbital nerve. So this is the supraorbital nerve. Okay, and here we have the second point, that infraorbital nerve, both side. Point one here also, right and left, both side, and two here also. Here also three fingers, and this is the base of the nose, where we have the third point. Okay, so these are the 3 points yesterday was discussed. And fourth point, that is bronchial nerves. Here we have the bronchial nerves. Yesterday we saw that is the fourth point. And we have the fifth point. You can see that solar plexus, center of the body. Okay. So these are the 5 points we completed yesterday. Now we'll talk about other remaining points. We have the sixth point, that is pit of stomach. And seventh point is gastric nerve. So basically, 5, 6, 7 is on the middle lining of the stomach only, or abdomen. Okay, so it is the beginning here, and we have the above the solar plexus. So it means that here we have the solar plexus, near we have the stomach pit, and below that we have all the nerves. Here we have the all the nerves. You can see that there are the nerves which are connected to the stomach. So these are the gastric nerves. So any issues regarding gastric, gastritis, flatulence, abdominal pain, you can apply electricity here. You will get immediate relief after applying electricity. Okay, so because it calms the nerves. Okay, and the signaling of the nerves will maintained. Okay, the pain will be disappear gradually. Okay, so you can see that these are the gastric nerves, and this is the pit of the stomach. So which remedies according to you apply here? So basically I will advise RE by E, alternately initially RE, then YE, RE by E, or else WE directly can apply. And second is along with F2 VER2. Those are the external remedies. So we can use F2 RE, alternately F2 YE, or F2 VER2 YE, or F2 VER2 RE, or directly F2 VER2 WE. That's it. Okay. So which dilution according to the condition? So we have the D6 dilution in acute, then subacute, chronic. Chronic can use a D4 dilution. Okay, so this is the points where you have to apply electricities. This is the sixth number point and seventh number. So 5, 6, and 7 both will come in the same row. Okay. Next we have point number 8. This crural nerves. So you can see that this is the pelvic region. So here Dr. Counts the given number 8 point. So because the anterior thigh is supplying multiple nerves to the lower limbs. So any problem of pelvic region, any problem in between the thigh and pelvic bone, you can apply here the electricities. Okay, so basically which electricity? Right side is negative, you can add positive electricity RE. Left side positive, you can apply negative electricity. Or according to the condition, you can make the protocol and apply. Okay, so here next point number 9. Point number 9, we have region of lungs. So here mostly here, because yesterday we kept one point here, that is bronchial point. Okay, so you can keep here the point number 9, that is the region of lungs. So here We could keep the point number 9 here, okay, and apply electricity R and Y E. But you will not apply YE direct on the heart region. Okay, so because heart is positive, you have to maintain the positivity every time. So Y negative, so it will calm down the heartbeat, or it will disturb the pacemakers, whatever may be the happen. Okay, so we'll apply BE to the heart. Okay, if heart rate is low, how to improve the heart rate, then you can apply RE. If your heart rate is more than normal, like 120, 140, 150, at that time, by observing the patient, condition of the patient, by medical equipments, you have to check the heart rate continuously, BP continuously monitoring. You can apply Y, but gradually you have to keep these things around you, monitoring all these vitals. Okay, then only you have to apply Y to that A. Then B is the safest remedy to apply on the heart. So on the lungs, you can apply a remedy according to the area, RE or YE first. Second, or else you have the most important remedy, that is P group. You can apply P1, P2, P3. Mostly P3 is advisable, or sorry, P2 is advisable. P2B is advisable to apply, or you can apply according to the holes of the body. Okay, so this is the eighth number. This is the point number 9. Next, we have point number 10. This is the angle of jaw. So this is the area. This is the point number 10. You can apply the electricities. So basically what will happen here, the pain in the jaw region, or pain in the tooth side tooth, okay, or in the ear because of the nerves. Okay, so you can apply electricities according to that area. So mostly unable to jaw, unable to chew, and some people who eat or take or smoke or take good cars. Okay, what will happen? Lock jaw will happen to them. So at that time you can apply the electricities. Okay, RE and YE respectively areas. Okay, or F2 RT, F2 over to RE, F2 YE, or F2 W you can even apply. Okay, so this is the angle of that, or buccal carcinoma. During the buccal carcinoma, you can apply the BEG also. Okay, BEGE. Okay, so G will heal, B will clean the blood tissue. Okay, so impurities. So basically, mostly in buccal carcinoma, cancer of mouth. Okay, so at that region, you can use this point. Okay, next we have the point number 11, that is lumbar region. Very, very important region. So nowadays, every out of 10, 7 members have lumbar pain, back pain because of the sedentary lives, or sitting always, unable to do exercise. Okay, and different things for different persons. So, okay, basically they are gaining the lumbar pain. So basically, you can apply REYE directly to the lumbar region, or according to that area. If this is the center area, so then center pain, you can apply REYE both alternately, or else if it is right side, RE, left side, YE. Okay. So by application itself, we can cure this lumbar problem. So I cured one patient. Okay, complete cured. Okay, he got relief from lumbar canal stenosis. So we have L4, L5, and L2, L3. Okay, both have disc prolapse. So the disc is uh, keeping irritating his nerves, and he has severe pain. So he went to the neurologist and he advised to do the surgery immediately because he unable to bear the pain, and gradually his foot start drooping, unable to lift his left leg. So basically, he came to my clinic and took the advice. So I told him that please give me 15 days. If you cure in 15 days, if you got relief 50% in 15 days, then surgery is not necessary. So he took he seriously he took my advice seriously, and I treated him 15 days. He got relief more than 50%. First, I started by application itself because he has severe pain. So you are directly attacking on the nerves which are affected. So then definitely will get the result. Okay. So after that, he had good life. He doesn't uh, he did not perform, or doesn't go to the neurologist for the surgery. Okay, so the lumbar pain is most common cases you will get. You can apply RE by E. My in my clinic I applied RE by E. So I started with IRE, after 5 minutes YE. So for 3 times you can do that: morning, afternoon, night. Okay. So basically, here you need to understand that the pain you here is inflammatory condition. So you can do the mostly for pain relief, you have to do hot compression. Okay, hot compression you have to do with hot water. You have to apply, or directly you can apply electricity on the area. Okay. So this is all about lumbar region. Next we have umbilical region. This is the point number 12. Okay, point number 12. We have so umbilical region. So 5, 6, 7, and 12. All these are coming in same row. So umbilical problem issues mostly in the ladies during menstrual cycle. They have the pain here in this pain here. Okay. Or for mostly children's, they have worms. During worms, they have the pain. Okay, in gastric disturbance, or else whose umbilical will get down, fall down. Okay, adjust. They need adjustment, umbilical adjustment. So you can apply or put the electricity at that area. Next, we have hypoglossal nerves. Hypoglossal nerve. So yes, you can see in that image, hypoglossal nerve, very important nerve. So we have 12 cranial nerves. In that 12 cranial nerves, hypoglossal nerve is one of the nerve. Okay, it is the 12. It is the 12th cranial nerve. Okay, so it's coming from the base of the neck, from the ear. Okay, and till the uh, cheek region. Okay, so what type of function it will do? It will have the control the muscle of the tongue. Okay, so most of the function of this nerve is to control the nerves, control the tongue. So I am talking with the help of this hypoglossal nerves. I am able to bend the tongue. I am taking the tongue to throughout my mouth, and while eating, it will help to chew the food, to take the food from one area to another area in the mouth. So this is the function of the tongue, and secrete the uh, saliva from the tongues, and you can taste. So all this with the help of hypoglossal nerves. So if any damage occurs to the hypoglossal nerve, basically in the paralysis, okay, you can apply the remedy here. So you will able to get the improvement. Okay. This is the 13 number point. Next is 14, very, very important. Again, lumbar point we discussed. Now 14 is sciatica point. This is a sciatica point. Point number 14. You can put this for the sciatica patient. So here the nerve is compressed in this region. So you can see the disc bulge happen So the pain will come radiates to the thigh region and to the lower limb. Okay, this is the very important point. Right side RE, left side Y. Okay. Next is arc of food. So heel pain, foot pain, drooping of food. Okay, and uh, number of diseases are there. So you can see that you can put electricity here according to the area. Okay, so you complete 14, 15. Next we have the 16, 16 and 17. 16, this is the 16 number area, hypoglossal, small hypoglossal area. Okay, and this is the 17 number occipital nerves. So occipital nerves, like we have the occipital head or giddiness or cervical, near the cervical pain, because occipital and cervical connected to each other. And we have what we have, and we have the vision. Okay, vision issues, you can apply electricity is here. So mostly you can apply positive electricity, or W is best. The head area can massage, gradual massage with WE to the occipital area. Okay, so this is the 16th and 17th number. Next we have cervical nerves. You can see the C1 to C7. We are seeing the nerves. Okay. So cervical spondylitis, cervical disc prolapse, cervical intravertebral disc prolapse, all these issues can be treated, or cervical nerve damage. I think we need with the help of this point number 80. What remedy? I told you in between you have to apply REYE alternately, or else WE, or according to the condition, F2 were to WE, or F2 were to RE, F2 were to YE. Okay, next we have the point number 19 and 20. Okay, 19 you can see the sacrum, coccyx. Sorry, 19 is coccyx. This is the coccyx area. So this is the ending point of the pelvic bone or vertebral column. We can see this is the coccyx, tailbone we will call, and above the coccyx you have sacrum. So this area, mostly hip region. Okay, here if any pain or unable to sit, or any fracture or nerve damage, you can apply the electricity here. Okay, so this is the 20 points of EH. So remaining 25 are there. So we'll discuss one by one. Okay, tomorrow some points, or day after tomorrow some points. Okay. If any doubts regarding this, kindly ask.